This patient is a 35-year-old female. She presents to the clinic with complaints of a rash on her bilateral arms and bilateral legs for the past 2 days. She does mention that 3 days ago, she was trail running, and she mentions that those trails were overgrown, so she thinks maybe she has come in contact with poison ivy. She complains that the rash has been itchy but not painful. She also mentions that the rash started on her right leg and has since spread to her left leg and bilateral arms. She's tried warm compresses, allergy medication, and calamine lotion with no relief. During the physical exam, her vitals are within normal limits. Her heart and lung sounds are also within normal limits, and she weighs 70 kilos. She has no known drug allergies. When looking at this rash, the rash is on the bilateral legs, her abdomen, her bilateral arms, and some on her chest. This rash appears to be raised, fluid-filled vesicles, and a lot of them are like either singular or in linear striations, which is congruent with poison ivy. She does not have any fever right now. She hasn't had any fevers. And she also has not had contact with new soaps, lotions, detergents, or any new makeups or anything along those lines. There are some differentials that can be diagnosed for her. Start with the least likely differential. We've got shingles. Shingles usually presents as a red, painful rash that typically doesn't cross the midline. So in this case, her rash is on the bilateral legs, the abdomen, the chest, and bilateral arms. So it's crossing that midline, and her rash is not painful. It's just itchy. Another differential is eczema. Eczema typically presents as like red and scaly patches, which her rash is red and raised and has fluid-filled vesicles, but with eczema, it's typically on the inside of the elbows and the knees, so this is another least likely differential. And then a differential that could be likely is an insect bite. Typically, insect bites are red and they have swelling and itching, but they're usually localized. So her rash is on her bilateral legs, bilateral arms, chest, and abdomen. So it's not localized, but in this aspect, she could have been bit in multiple places, causing a rash, but this is least likely as well. So for the primary diagnosis, we've got plant contact dermatitis. Her rash is red, raised, fluid-filled vesicles and linear segments on the bilateral arms, bilateral legs, abdomen, and chest. There are a couple different treatment options for her that we could go. This rash is over about 10% of her body. We're going to do a treatment plan that includes educating the patient on skin soothing measures. This can include oatmeal baths, cool wet, dry compress, and calamine lotion. I know she's used the calamine lotion, but maybe with some oral medications, this could help relieve that itch for her. We're also going to educate her on carefully washing under her fingernails, as oils can stay under the nails if not washed properly, and it can also stay on clothing, and then if she's touching that clothing, it can spread as well. As far as medication goes, we're going to prescribe her prednisone 1 milligram per kilogram a day. She does weigh 70 kilos, so she is going to get 70 milligrams a day for 14 days. It's under a 21-day window, so there's no tapering needed. As far as follow-up, if the rash persists or it continues to get worse over the next 5 to 7 days, she's to reach out for further management, so we can get this rash under control. She may need an injection, but if in 14 to 21 days her rash is minimal or it has resolved completely, there's no further follow-up needed unless she has issues. So I think this is a good game plan, and hopefully this helps relieve her poison ivy rash.